According to the National Institute of Allergy and Infectious Diseases, food allergies continue to affect 2% of the U.S. population and 4 to 8% of children. New studies are reevaluating when we introduce certain foods into the diet of our children. And here to discuss all this with us is allergist and immunologist Dr. Nita Ogden. Thanks so much for joining us, Dr. Ogden.
Thank you.
So a new study in this month's Journal of Allergy and Clinical Immunology actually examines whether introducing food in early infancy can affect a food allergy. So tell us first what this study said.
Right. Well, there's a lot of ongoing investigation as to whether we're waiting too long to start certain foods in our children's diets. And this study from Wayne Hospital in Detroit actually explored the relationship between introducing certain allergenic foods like cow's milk, egg, and peanut into the diet of children less than 4 months old.
Wow.
And the relationship of that to something called food sensitization, which is different from food allergy.
Right. And what is food sensitization?
Food sensitization is the presence of something called food-specific IgE, and that is the antibody that's responsible for allergic reactions. It can be detected by blood tests or by allergy skin tests. Alone, it does not make the diagnosis of food allergy. You need a strong clinical history, the blood test or the skin test, as I said, and possibly an oral food challenge. However, it is used a lot in literature and in studies as a possible predictor for developing food allergy.
To getting to a food allergy. So, like you said, the study looked at babies younger than 4 months old. That seems awfully early to me. What did they find?
So basically, they followed these kids who had been given either cow's milk, some form of cow's milk, egg, or peanut before 4 months old, and then at 2 to 3 years old, they checked their blood work for food-specific IgE and compared them to kids who had not had that early food intervention.
Okay. Basically checking for food sensitization.
Exactly.
Okay.
And what they found, interestingly, was that in kids with a parental history of allergy or asthma, so those kids are actually usually more at risk for developing some kind of allergy.
Right.
Those kids who had also had the early introduction of food had a much lower presence of peanut-specific IgE compared to the kids who had not been given the early food introduction.
So when I hear that, the suggestion to me is that if you introduce some of these foods a little earlier, your kid might not end up down the line with an allergy to peanuts or other foods.
I think that's where this kind of information is heading. The study itself, the authors admit that there are a lot of limitations here. They were relying on parents' memory and recollection for their data, which can be unreliable.
Sure.
A lot of the parameters they looked at were not statistically significant, so no one should go home and start giving their 3-month-old these allergenic solid foods.
That's the bottom line question. We want our viewers to be clear what doctors are recommending. When do you start introducing these foods? Should you introduce multiple foods at one time? Is there a consensus in the medical community about this?
Well, fortunately, food allergy guidelines were just released in 2010, and they do give a lot of dietary recommendations to guide practitioners and patients. And what they say is that around 4 to 6 months of age, when solid food is introduced, pretty much everything is fair game, which is a break from what we've traditionally done in the past. And this is something new for both doctors and patients, and it's something that we're all discussing in our offices about what's the best way to proceed with these guidelines.
Would you still recommend that a parent start one food at a time?
Absolutely. I think that no matter what recommendations your doctor is making, they're always going to say start one food at a time, wait a few days, see if there's any reaction, because sometimes food reactions occur after the second or third exposure, and then start another food. But
don't necessarily limit the variety of foods.
Yes, exactly. So, you know, if you're a child who doesn't have a strong family history, your doctor may very well say everything's fair game and you can start any solid food.
There's also this new lab test, I understand, for peanut allergy. Tell me about that.
Yes, researchers at the American Academy of Allergy, Asthma, and Immunology this month at their meeting presented findings of this test which can detect IgE antibodies to 4 components of peanut protein. And this is really promising because right now we don't have a very accurate way of weeding out those children or patients that have a true severe peanut allergy. And this test showed that children who reactions to peanut had higher levels of antibody to something called RAH2, which is a component of peanut protein. So it's not FDA approved yet, but they do think it'll get licensed within the year, and I think it'll be very useful in terms of diagnosis.
So important, and I think this topic is so confusing. Would you agree that there still needs to be quite a bit of research on this topic for us to be able to clarify what to do?
Yes, yes, I think that this is the takeaway point from this study. There is a lot of room for research. Possibly dietary modifications can really be something we can use to prevent food allergies in the future for our children.
I guess the bottom line is you should talk to your doctor about your specific baby. Well, thank you so much, Dr. Ogden, for clarifying at least some of it for us. And for more information on this topic, as well as others, log on to the health page at abcnews.com for all the latest health news.